here at Lephalale for a workshop which focuses on the clean air as well as the health aspect. So the workshop basically is attended by local activists who are coming from different villages and areas of the Waterberg region, where we're also looking at how basically the communities will be able to collect samples, the air quality, using the portable air quality monitoring station, which is called an airbeam, and to collect data of the state of the air quality. This data will actually be used to cement and amplify the arguments that the civil society organizations are actually advocating for in response to the issues of the state of the air quality.
Transparency is not there because I think most of the information community, they don't want to share that. It seems like they are lying to us. How are we going to trust whatever the data ever capturing? Is it true or is not true?
It would have been more effective and capable on the ground with the real people that are experiencing the real problems. Because what we're getting report from the stakeholders or from the organizations. They had collected data, using whatever resources they use. But in terms of the information and the real issues and challenges that they face communities, they face the environment activists, everybody outlining. We don't have like a picture yet or now, or like literally informationally providing. Is it related to the problems or those communities?
So there has been a lot of complaints that I imagine daily, particularly with this area, the Lephalale area, where some of the industries have actually, continuously exceeding the limits in terms of the minimum emission standards.
The Department of Health is still lagging behind. We need them more, but I think we're constantly trying to engage them, to put them on board, because we can quantify the pollutants, know that so much pollutants are happening in the area, but we cannot relate it to the health impact as to on the ground, how many people are suffering because of such pollution. So we need that link from the Department of Health.
First of all, how can assess status quo? The challenge is still real. From a clean air fund point of view, there's a role that we can play. It's a role that recognizes there are already players in the space that have got specific responsibilities. As a clean air fund, that's same as the Department of Health, they have a responsibility that they must fulfill. But there's an opportunity for us to support Batubao in fulfilling their responsibilities.
The importance of communities understanding air quality data. What is an exceedance? What does it look like? And in your presentation, you were able to show how the A-beam is able to depict what that looks like, the green, the red, and what that means. And I think our intention with rolling out the A-beam is to first ensure that communities understand what is air quality and how do you monitor it, right, through the A-beam device. But also our intention is to have communities have a better understanding of environmental governance and actually participate. So by having the A-beams, they're able to participate perhaps in a better way in the ITT, to sort of say in Marapong, this is what the air quality is looking like, right? And have the data demystified so that it's not something that we're just seeing from officials on their presentations, on their fancy graphs, so that communities also understand, how the graphs work.
Beyond this point, there will be a continuation of collecting of the air quality and also reaching out to more communities in response to the state of the air quality and health issues that communities are facing in the Waterberg region.